doctors everywhere.
This is a chronic problem. It definitely got worse during COVID. And unless we have a renewed and sustained investment in the healthcare system, it's not going to get better in the short term.
As Montreal enters the new year, emergency rooms in the city continue to be pushed beyond their limits, many operating at over 100% capacity. By Tuesday morning, the ER here at the Shim downtown was at 135%, a trend healthcare professionals are warning may continue well into the new year.
You'll start seeing more cracks. You'll start seeing people who are suffering more, and I'm talking about patients and workers.
For consecutive days, Montreal has seen high emergency room occupancy rates. Tuesday morning, the Royal Victoria Hospital was at 145%, the Montreal General at 168%, Maisonneuve-Rosemont at 152%, Verdun Hospital at 169%, and Lakeshore Hospital at 210%. This, even as COVID-19, influenza, and RSV cases have started to decline in Quebec.
Emergency rooms can only handle so many people per day, and there's just more of them. There's just a lot of people getting sick. So even though the trend is down going, the total number, absolute number of people getting sick is still quite high.
Hospitals are still dealing with backlogs for treatments and tests that weren't available at the height of COVID.
Getting tests for heart disease and cancer were, harder. And the problem with not getting routine tests done in a timely manner is that when people are actually sick, if you can't diagnose them quickly enough, what happens? Well, they end up in the emergency rooms.
Quebecers are encouraged to call the provincial health hotline 811 for non-emergencies and should seek emergency care in urgent cases.
A lot of people, for understandable reasons, say, well, I don't want to go to the hospital because of everything I'm seeing. And that, makes them stay home for longer than they should and potentially get worse and suffer more long-term problems.
Some are now sounding the alarm for Quebec to do more for the future of healthcare.
We have governments right now who are planning short term, only in the present, and not looking towards the future, and not seeing how we are going to be even in a greater deficit in the coming years if we don't make sustainable and incredible changes to our healthcare system.
In Montreal, Felisha Adam, City News.